Right, good afternoon everyone. Welcome to this Thames Valley Chamber of Commerce webinar with the Health and Safety Executive, talking about COVID-19, health and safety and the organisation of the Health and Safety Executive. We'll be hearing directly from the HSE on the critical work that they've been doing to support businesses like yourselves during this COVID-19 outbreak and how the support that they've been given can help your organisation. That's me. I'm your host for today, account manager at Thames Valley Chamber of Commerce. My contact details are there on the slide if anybody wants to get back to me. I should note that picture there as me is pre-COVID lockdown, hence the reason why I'm not showing my camera today. Pleased to introduce our speakers for this afternoon. We have Martin Temple, CBE Chair of the Health and Safety Executive. Matthew, who will be our main presenter today, is from the Science Division, and we're joined by Rob, Claire and David, who will be on hand to answer any questions that anyone might have. Introduce you now to Martin. Martin will be providing a very quick update before we hand over to the main presentation. Over to you, Martin.
Thank you, and hello everyone, and I hope you find this webinar useful, where we're trying to guide people through the challenges of this COVID world. So I'm going to give you a little bit of background on, sort of things we've been doing, and then Matt will take you into a more specific presentation. I'll start by saying that throughout the pandemic, our first priority has been and remains so, enabling work to continue wherever possible and protecting those at work. Over the last few months, we've issued revised and we hope proportionate operational policy positions to a wide range of industry stakeholders and sectors, and it's constantly reviewed and supplemented in the context of up-to-date science and evidence. As you know, we're all learning as we go on this particular journey. It's all available on a dedicated coronavirus microsite. I suggest you subscribe to it. It's free. And the value of subscribing to it is that you receive automatic updates as things develop and change in the areas of particular interest to yourselves. So it's a good idea, rather than thinking, have things change, you get it through automatically. Now, there is no doubt that the pandemic has highlighted the importance of so many sectors to our economy, which perhaps people didn't look at with quite the same priorities before. What is absolutely amazing is that we have seen some excellent innovative responses by businesses and organizations to the issues presented by COVID-19. And so as we continue to learn, I advise you to network through organizations like the Chamber Movement, liaise with each other, network with each other to find out the sort of solutions that other people have discovered in their business, and I'd just then say steal with pride. As you know, it's a requirement to do a risk assessment to enable a safer return to work, considering the risks in conjunction with your workers and worker representatives. And this has proven to be the best and most suitable and effective approach. Hopefully, we believe instilling a feeling of reassurance in the workforce that the right and sensible measures to keep them healthy and safe have been put in place. Now, at the heart of it is really, I suppose, a common sense approach. When the rules are not clear because they can't cover every single situation, it's important that social distancing under the prevailing conditions at the time and good hygiene remain at the heart of controlling risk. And apart from PPE, where the task requires it, PPE for COVID would normally be the last resort. Now, a little bit now on what we've been doing in the background. On our regulatory activity, it's been continued because, of course, many sectors have not stopped working, or at least some have only reduced to a relatively small amount. Examples being agriculture, which has been going fully forward, certain areas of construction, lots of areas of manufacture, particularly food manufacture, financial services, and things like transport and logistics, which have been working flat out. And throughout the pandemic, we've received well over 29,000 COVID contacts, and of that, 8,700 plus have been concerns, which we've received, and about 7,600 or so COVID-related advice requests. And of course, in the context of concerns, some have resulted in inspections where there were ongoing concerns. We've significantly increased the capacity of our concerns and advice teams. And there is a lot of information on our website and also on various trade bodies and the BCC websites. But if all else fails, our advice and concerns teams are available to all. And again, it's a free service for you to either ask questions or, if you have concerns, to raise those concerns. Now, it's important to note that across all sectors, we will continue to investigate work-related deaths, which sadly have continued to occur, serious injuries and dangerous occurrences, as well as reported concerns from the workforce or the public where people are thought to be exposed to risks from work activities. And we have, and will still do, take action to secure compliance with the law when it's necessary. I repeat, though, that our absolute priority is to enable work to continue safely and healthy. Now, on what I hope is a helpful point, under the Health and Safety at Work Act, employers have a general duty to ensure that, so far as is reasonably practical, the health, safety and welfare of their employees is looked after. Now, these requirements continue and have not diminished. Now, in the context of public health issues on COVID-19, HSE considers that if an employer is following the relevant Public Health England, or in the devolved areas, those devolved guidelines, if they're following that guidance for their sector in terms of controlling public health risks, they will be taking reasonable practical precautions to control workplace risks. Now, with regard to guidance, COVID-19 secure guidance for business on the necessary safety measures they will need to adopt was published on the 11th of May, and that was supported by an HSE guide on working safely during the outbreak and a toolkit to support employee engagement alongside the announcement. We've been heavily involved with others, notably BAYS, the business department, on the return to work guidelines for all sectors and activities. Much of that is now in the public domain, and that's been going on over the last few weeks. And work continues on some of the other sectors that remain to be clarified, I suppose most notably hospitality and the beauty sector. As I said earlier, we've still been active in the workplace, and as many of you will be aware, we normally concentrate on visits and inspection on areas where we perceive there is the greatest risk, or in response to specific information we might receive which suggests that an inspection should take place. However, in line with requests from the government, we've introduced spot checking, businesses for compliance with safer workplace guidance. Now, this will involve HSE inspectors, or does involve HSE inspectors, and those from local authorities. All sectors are in scope for spot inspections, so what may have been considered as low risk in terms of conventional health and safety may well now receive spot inspections in terms of public health matters under the COVID guidelines. It has actually been very gratifying that on public health issues relating to COVID, the vast majority of companies are doing very well and respond very quickly to prompting when small elements are not quite right. Some of the common issues that inspectors are finding are the failing to provide arrangements for monitoring, supervising and maintaining social distancing, failing to introduce an adequate cleaning regime, particularly at busy times of day, and providing access to welfare facilities to allow employees to frequently wash their hands with warm water and soap. On a point of detail, on the 22nd of May, we published further guidance on managing Legionella risk. And as workplaces open, and in particular when air conditioning systems start up, this is a particular area to be careful about. By way of background, from the day one of the pandemic, we've been active in a whole range of areas, and let me give you a few examples of that. We've worked with public health England and the devolved administrations on early overall guidance for general infection prevention and control, secondary care, handling chemical waste and clinical waste, and prevention of infection from the deceased. We also covered a very wide range of facets of RPE and PPE relating to use, to reuse, alternatives where the preferred one is not easily available, and fit testing and guidance. And additionally, testing of PPE from new sources, particularly from abroad, and new manufacturers in the UK. We've also been engaged in changes to the ways of working in some laboratories to enable them to enter the testing capacity of COVID-19 samples, which, as you know, was a very big issue right the way through the early parts of this particular pandemic. We've also been engaged in unblocking obstacles to enable drink producers to switch ethanol production from drinks to biocidal hand sanitizer products. And again, you may recall at the start of the pandemic, sanitizers and that were in desperate short supply, but now a lot more are on the market. But in recent weeks, the return to work and all the challenges around that have dominated our work. And that's where you've seen the guidelines that we produced with Baves and one or two other people, but those have then been taken by the politician and made into what is now the more public policies of the return to work. So that's me finished, other than to say, can I remind you that our various websites are full of detailed information. The chambers carry a lot of this information as well. And some of you may find helpful a video produced by Aggregate Industries. It's not the only one, but Aggregate Industries have put one up for people to use, which is a big complex business, about how it's handling COVID risk in a very comprehensive way and in line with the need to run their business effectively and efficiently. So that's me finished. I'm going to hand over to, I think I'm handing over to you, aren't I, Dave? We're
going to hand over, thank you very much, Martin. We're going to hand over to Matt now, who's our main presenter for the presentation.
Oh, it's Matt, is it? Yes.
It is Matt indeed. So if I can, over to you, Matt.
Thank you very much, and good afternoon, everybody. And thanks for Sonny for giving me access to the PowerPoint. Appreciate that. And thanks for spending time looking at DSE and giving me some an occasion to talk to you a little bit about it. As we are beginning to return to work, for some of us, it's becoming more apparent that we are going to spend longer at home, and those of us who can work at home should work at home in conjunction with government guidance. And so many of us who are otherwise office-based have been asked to work at home for longer periods, and it's just really to clarify the kinds of guidance that you might wish to give people who are working at home, and to give you some sources of that guidance. One of the early questions we've been asked at these kinds of events and others is regarding standard DSE risk management for people who are working at home. And there are almost two tiers of risk management, and they do often get confused, I suspect. So just to deal with that first of all, if you have home workers, people who pre-COVID were designated home workers and are working at home as a normal part of their working profile, then they would require a risk assessment for their DSE workstations at home as per you would normally do. But for those of us who are temporarily working at home, we don't require that written risk assessment as per the DSE regulations. Now, temporary has been a word that we've played with an awful lot of, and it may have caused some confusion. Temporary doesn't mean a month or 2 months. It means for outside of your standard working profile, and it's looking more and more likely that temporary for many of us could last towards the end of the year, if not beyond for some of us. They would still be considered temporary workers, and our policy on risk management for them is to do what you can, absolutely, and we'll show you some ideas here, but to not try and engage them, your workforce, with doing assessments as you perhaps traditionally would do. We certainly don't want you sending any DSE assessors around to people's homes to check out their workstations. Beyond that, though, it's about supporting your workers as well as possible. And there are a number of tips, a number of resources that we can link you towards on our website and others that will help you do that. So I want to start just by looking at, if I can get the, Sunny, could you move the PowerPoint on for me, please?
Yeah, I can certainly do. There we go. How's that?
Quite giving me. There we go. So I want to give you some home setup tips. Some things that are very pragmatic, very practical, and within reach of all of us, and the kinds of advice that we're giving to people who are working at home. Now, fundamentally, then we'll run through this one at a time. It's not great a presentation for a webinar. We've purposefully kept it simple. And the idea being, I'll mention each of these points, and you can take this away as a written record. Share it if you like with your colleagues. If you're fast enough on a screenshot, tell you when to do that. Or otherwise, use this as a resource for reference later. Now, first and foremost, probably most of us are working on laptop devices. And with a laptop device, it sounds very simplistic, but as best you possibly can, do try and work on a table. For most of us, that's a dining table, although given the length of time of working at home, we've made alternative arrangements set up. But that's really fundamentally important. I know a laptop device suggests you would work on your lap, but actually, ideally, you want to be setting up on a table with a device directly in front of you, so you're not twisting in the spine. None of these kind of postures of twisting or looking downwards at a laptop on your knee, none of them will do you harm in the short and medium term. But they will cause discomfort, that will affect performance, and in the longer term, you may well exacerbate into something that we call a musculoskeletal disorder, something that can have a more prolonged impact on your musculoskeletal well-being. So set a laptop in front of you. If you are working on your lap or something, try and find the right compromise. Elevate the laptop by putting a cushion on your knee to elevate the screen slightly. It'll reduce the kind of flexion, the forward bending in the neck. It will put the keyboard a bit too high, but it's finding the right compromise, the right balance between your wrist posture and your neck posture. If you are going to set up, and hopefully you can set up at least on a dining table, you might find that the dining table is a little bit too high as well. Generally speaking, dining tables are about 8 or 9 centimeters higher than the standard office workstations or work tables we have in the workplace or in the office. The purpose is set a bit higher because eating is slightly different to office work. But when you're doing office work on a dining table, you might find that it feels like the keyboard's too high or that the seat is perhaps a little low. Absolutely fine, just bung a cushion underneath yourself. Sit on a cushion and elevate your body. What you're really aiming for is to get the keyboard at elbow height, and we can deal with the feet and other things in a short while. So if needs be, elevate yourself in the chair and get the keyboard roughly just below, if you can, elbow height. You can start sitting in a comfortable position. While you're going at the cushions, grab another one and put that behind your lower back. A little bit of support in the lower back. It's not fundamental. We can work without it, but for long periods especially, it does really support and improve that comfort. If nothing else, it improves the awareness when people start to slump in their seats, which we all will do at least after 40 minutes. And we start to slump in our seats. It acts as a prompt, as a reminder, and as a support just to keep that curvature of the spine, especially in the lower part of the spine where it does start to ache after sitting down for long periods of time. Could you click me on again, Sunny, please? My keyboard doesn't seem to be doing moving the slide. Thank you.
How's that for you?
That's great, thanks. Relax the shoulders. Again, it's all about keyboard height. And if the keyboard is a bit too high, there's a tendency to just elevate the shoulders. I'm doing it now, it's not doing me any harm, but after a day, or certainly after a few months of working at home, that prolonged elevation of the shoulders can lead to tension neck syndrome, which is typified by an upper neck pain or a headache towards the rear of your head there. It can be difficult to get rid of. And so we want to make sure that the shoulders are loose and relaxed. And that's the kind of target we're looking for when we're setting the height of the keyboard versus the height of the seat. So when the seats, you've elevated the seat, you've got it to the right height, it may be too high for you by now. You're accommodating a higher table, and especially if you're sitting on a dining chair and on a cushion, there's a good chance that your feet are swinging. What you want to really be conscious of and get mindful of is spreading the weight across the front and back of your thighs. If you're sitting on a chair that's too low, you'll be sitting on, we call them the IT points, the ischial tuberosities. There's two bones. If you're lucky enough to have people sitting on your knee and you say, oh, you've got a bony bum, it's those two bones that we can spread our weight over, and it can really ingress into the soft tissue in the buttocks and cut off blood circulation. No big deal. It just causes pins and needles. And let's be honest, if you've got Candy Crush on your phone and you go to the loo and get on a hard level, that's the kind of thing that gives you pins and needles in your feet for a while. Not the end of the world, but if you're doing it for prolonged periods, for months on end, that can start to have an effect on your lower limb circulation. Similarly, if your chair's too high for you and there's too much pressure at the front of your thighs, that again can cut off circulation a little bit, give you pins and needles. Now, we don't think, there's no evidence to suggest that these kinds of circulation problems cause DBTs or varicose veins in the lower limbs. We don't think there's a prolonged health effect of them other than discomfort, but they do affect our ability to recover from those kinds of ailments. So we would recommend having a reasonable flat surface to sit on with equal pressure on the front and the back of your thighs. Thanks, Sonny. If you just put me again, thank you, mate. In the office, we normally prescribe roughly 5 minutes of break time every hour. Unfortunately, break time doesn't mean hitting the hammock or going outside to get fresh air, although that's ideal. Break time means motion, means movement and mobility. Whenever we're working at the home, though, our postures will be compromised ever so slightly. And so instead of having 5 minutes in the hour break time, we would suggest taking more frequent and slightly prolonged breaks, adding up to about 10 minutes every hour of break. Again, break doesn't mean, necessarily getting on the sun lounger. It means doing something else other than being at your DHC workstation. And whenever you've got phone calls, for example, turn the garden into the boardroom and go for a walk around the garden while you're talking on the phone, or go for a walk around your house and talk around while you're talking on the phone. Get up and stand up and move a bit. Just give all the parts of your musculoskeletal system time to recover from being in a prolonged sedentary posture. And then about setup, where should your screen be? This is difficult to do if you're on a laptop. And ideally, we would have you go out and we can purchase keyboards and mice. Hopefully, you may get into the office, and if ever you do, with permission from your management, try and steal a keyboard and a mouse from your normal desk. Or you can buy these for less than £20 off the internet. But what we'd like to do is set your screen roughly at tickle to punch away. So you can just tickle the screen at arm's length. That would make the keyboard difficult to reach. So having a separate keyboard and mouse will make that a lot easier to push that screen backwards a little bit. So it's at a decent viewing angle for your eyes. About arm's length, tickle to punch distance away when you're sitting naturally. The top of the screen should be at eye level, so horizontal as best you possibly can. That eliminates any neck forward flexion, gets rid of those possible tension neck syndrome, the kind of headache at the back of the neck that's very hard to shift. And then the other thing I think is about environment. Look, this is where I normally work. I'm very privileged to work in Buxton, and that's our environment. I'd say that's at winter time, but that actually could be, if you've been to Buxton, that could be pretty much any time apart from August where I work. But it's a very idyllic place. There's 400 specialists in the fields across the different areas of health and safety. We have laboratories, we have colleagues, we have our managers sit next to us, and we have access to an awful lot of very good IT. That was around about February this year. If you could just click on more. I'm actually talking to you from that shed in the back of my garden right now. Window and wave, but that's an image, not a video. That's where I've gone to from the marvelous infrastructure of where we normally work. Now, as idyllic as that is, and my commute's got a lot easier, I'm not going to pretend I'm suffering whatsoever, but it just means my access to all the normal things we'd take for granted in offices has diminished greatly. And so the real message is, think about your environment. Is it conducive to do work? But also think about the environment of your colleagues, and do be kind. Whatever that looks like, have a little bit more patience, have a little bit more understanding. God forbid the Zoom meetings you have where the dog barks or the Amazon person comes and the children need attention. Be kind for all those things. They are creating somewhat of a stressor on people. And as a colleague of mine here, Rob, will talk about, is mental health is a very significant issue, especially as we move forwards through this COVID period. Do bear this in mind with deadlines, productivity, and those communications, and do set up support systems for work, as my colleague Rob can allude to. Thanks, Sunny. And so there's lots of resources for you. There's lots here. Now is the time, if you're quick enough, to do a quick screen print. I think control screen print will grab you all this. I believe these will be provided as well. Maybe you already have in the chat box as well.
Yep.
But these are just some links, really good. Thanks, Sunny. Some links to some really good parts of guidance and clarification, things that you can share quite easily with your colleagues, just to keep promoting home DSE and working at home at the top of people's hearts and minds, so that and maintain that mindfulness. The top link there is to our own website with policy on there about working at home, and with a PDF checklist that you can use to have your colleagues just check their own workstations and become mindful in a relatively formal way that they'll probably be familiar with from doing their own DSE assessments. The Chartered Institute of Ergonomics, and that's a very good infographic that's got the key principles of home working on there, talks a little bit wider about setting up an environment and for better mental health, better concentration as well with work. Guildford Ergonomics is just a very well-known ergonomist who's put that out and kindly shared it with us so we could give it to you guys for free. And then the YouTube clip, second from the bottom, it's just a silly 3-minute clip. It actually is technically very good. The advice it gives is very good. It just has no words, there's no language, and so it's very accessible for everybody, and talks about setting up DSE in a home and gives some very pragmatic advice. And if your kids are like mine now, there's no stopping them. I think they're spending around 7 hours a day on Minecraft. If only we could cash in on that kind of Minecraft and online gaming activity. If you've got kids at home, by all means, do engage them with the decent DSE setup. The bottom link there is from a supplier that we know. He helped develop the guidance in the ergonomics for kids. But if you wanted to talk to others about DSE, how to actually literally play on Minecraft or whatever it is for hours on end, but do it safely, that's a very good link, and I'd suggest you have a look at it just to engage the kids. And again, we learn what we teach, don't we? So a good way of raising the awareness amongst others. So that's it from me. Thank you for your time. I hope that's been useful. And I'll hand back to Sunny and see if there are any questions with regards to DSE at home.
Yeah, wonderful. Thank you very much for that, Matt. Much appreciated. Regarding the useful links, there's another sort of slide here. If anyone does request a copy of the presentation, please email me directly. We can send these out links separately via a separate email, or we can send you a copy of the presentation. Alternatively, I'm sure you guys can agree, feel free to get in touch with you guys directly at the Health and Safety Executive. I'm sure they'll be more than happy to help. So, as we come towards the end, any questions? We did receive some questions earlier on, but we'd like to keep this an open discussion. So if anybody's online now have any sort of burning questions that are sort of keen to get answered, speak or forever hold your peace, as they say. If not, we'll go on to some of the sort of pre-requested questions. While people are starting to think of questions, I'll just ask you guys one that did come in earlier on regarding mental health. So how can HSE encourage employers to do more to reduce stress and improve well-being in the workplace? I am a trainer in mental health and well-being, so I'm very aware of the work HSE are increasingly doing in this area. Their stress assessments, etc. It sometimes seems that employers do not see that health includes mental health, and they have a duty of care there too. How can we get more engagement in this area? Is legislation needed? Should mental health first aiders be a legal requirement as physical first aiders are?
I'll take that, Sonny, if I may. It's Rob.
Thank you.
I can't see anything. I've just got your question screen, so hopefully people can see me. But I'm Rob. I'm the head of the stress policy team in HSE, and it's a very good question, and I'm really pleased to receive it. Very often mental health issues are overlooked at this time. And when we have the opportunity to speak to organisations like your own, it gets left in the shadows behind the physical, the social distancing, the hygiene requirements and PPE issues. But mental health is just a critical sort of issue for us all at this point in time, and particularly for employees who are going back into the workplace or continuing to work from home. We want to ensure, and our guidance is providing for that, employers have the best information to help them support and manage people who may be feeling anxiety, who may be concerned about going back into the workplace because of the fear of the virus. And just picking up the elements of the question that was asked, in terms of what we're doing to encourage employers to do more in this area, well, you may be familiar with, and your members may be familiar with, our Go Home Healthy campaign microsite. And on this site, we're promoting all of the good work that can be done on mental health, stress and well-being, amongst other areas. Matt's just explained MSDs and DSE. But we're working also in collaboration with business intermediaries, employer representative bodies, the trade unions, other partners who have very much the same end goal, such as ACAS, British Safety Council, CIPD, IOSH, MIND, and other government departments, just to name a few, give a flavour really. But we've not stopped in terms of the site being launched a couple of years ago. We've always recognised that trying to get employers to do the right thing in looking after the mental health and well-being of their workforce tends to often fall behind the more apparent hazards and safety risks and health risks in a workplace. And often it's sort of hidden, but we're trying to make sure that they have the tools to enable them to sort of dig a little deeper when they're engaging with their people, asking the right sorts of questions. And very often the conversation will go, "How are you?" And the response will be, "I'm okay," and you move on. And what we're looking for is to help managers, team leaders and supervisors, owner managers in smaller businesses, to be a bit more psychologically savvy in terms of the questions that they ask, to elicit the real sort of feelings, emotions, concerns that their employees may have. And it's all part of trying to provide the reassurance either to continue working from home, on furlough, or returning to work, which is going to be a major transition and change and create all sorts of anxieties. So we're doing a lot on the promotion front. I think that was the first part of the question. I've mentioned some of the tools and guidance. We've produced a talking toolkit, and this has been developed on the basis of feedback that we've had from business in terms of how they may be able to help their managers have conversations with people. And that's the nub of it. It's having a conversation to talk about the issues. And very often we're finding that managers, supervisors, owner managers often find these conversations to be difficult and don't know where to start. So our talking toolkit provides a framework whereby an informal conversation can be had, picking up on the issues that may be leading to stress, mental ill health, anxieties, and identifying areas where support can be provided in the wider well-being area. So we've got a lot of support all on our website. I think that's been referred to a few times. And I think I go back to the second or third part of the question rather is about regulations. Well, I think Martin mentioned earlier, there's the Health and Safety at Work Act, places a duty on employers to look after the health, safety and welfare of their workforce. I would stretch welfare to include mental welfare. So there's a duty in that regard. And I think the management of health and safety regulations require risk assessments, and we've talked about that already, and we've provided guidance on our website for a COVID risk assessment. And if members look at that, they'll see there's a significant part in that around mental health and well-being, and what employers, line managers should be doing when they're engaging with their workforce to ensure that they've got a better handle on what the issues might be and how they can work together with their employees to get to a point where there's a satisfactory sort of agreement on this is what we're doing to provide reassurance for that. So we don't believe there's any need for further regulation. We've got that. And that extends to first aid and mental health first aid. The question asked about that. And our position on that is that whilst we accept it's another contributory factor that will help employers to ensure that mental health is being taken care of, hopefully, in their workplace, it's just another contributory factor. And whilst we would always welcome that, as we do with a host of wellbeing initiatives, we don't feel that there's any need for further regulation. What we have done within the first aid regulations, and particularly where the risk assessment is concerned, is recommend that employers, when they're doing that, they include an assessment of mental health. So I think we've got enough of the ground covered to ensure that we're doing as much as possible to support businesses. So I think extra regulation always smacks of extra burden on business, and we don't want that. But I think across the piece, we're doing everything within our powers, and it's on the basis of feedback we're getting from employers' bodies, from the trade unions, to ensure that we're doing as much as we can to help support employers in managing this coronavirus and its sort of collateral damage, as we've been discussing.
Wonderful, thanks Rob. We've had a question come in live. Matt, I know you've answered it. I don't know whether you want to answer it on the webinar now, but the question was around, at what stage does HSE consider temporary working will be deemed permanent and trigger employers' obligations to undertake a DSC risk assessment?
Yes, thanks. There isn't really a timeline. So the word temporary has caused lots of misnomer and confusion. And there isn't really a timeline against that. It's not after X months it's considered to be a permanent position or permanent role as a home worker. I think there's got to be a pragmatic kind of approach. Obviously, if organisations are changing contractual arrangements, if organisations are formally turning people from office-based workers into home workers, then that would be a line in which would be crossed and it would require extra additional risk management. But even then, sending people around as DSCSS to look at people's workstations in their home at this present time and during the pandemic wouldn't be advisable. It wouldn't be good practice. So even then it would be a case of doing the best job we possibly can, a very pragmatic approach to having individuals assess their own DSC workstation layout at home using the tools that we supply on our website, like the PDF downloads, for example, of checklists. Now, to be honest with you, we can be doing that anyway now. And so the actual change from an office-based worker who temporarily is at home even for months on end to a home worker, it doesn't really implement that change. Let's do that anyway with all our workers, whether they're temporarily working at home or otherwise. And so there isn't a line really, unless it's a contractual change, in which case we would expect something more to be put in place. But for the time being, it's a case of do as much as is safe to do, as much as you can, and engage the individual being at their home to have a go at assessing their own workstation. Try and capture that if you can as part of your risk management process. And if people are home workers, try harder. Do try and make sure that that risk is being covered. But we have to appreciate at the moment it's important to protect people's health and well-being as best we can, but there are going to be limitations. And one of the limitations very specifically is going around people's houses with a tape measure and a clipboard to do a DSC assessment if that's the way we do things. And so the short answer is there isn't a direct line, there isn't an absolute, a contractual change may be that, but whether it turns into months and months, that won't change this idea of it being temporary. God forbid, but if we are still working at home this time next year, and I don't think there's no reason to think we will be, but if that was the case, it would still be considered temporary.
Thank you. Another question coming, I think it might be towards you, Rob. What happens if an employee is too anxious to return to work? Can they be forced, or indeed can they be sacked? Anyone want to pick that up?
Yeah, I'm picking that up now.
Thank you.
So, yeah, it's a difficult one, this, and it falls into the employment sort of law arena too. You know, I think it's not one that we could advise on directly, but I think the employer should be flexible, should show some understanding, should be looking at the options available if an individual can't return to work before making any knee-jerk reactions such as dismissal. You know, and that could lead into all sorts of other issues around the dismissal being unfair or consideration of that. But I would suggest that for that type of inquiry, then the questioner may wish to contact ACAS to square away what the employment law position is on that. But yeah, it's not an easy one to deal with, but I think what you're looking for is understanding, flexibility, and a joint conversation between the two parties to try to get to some consensus agreement on the steps forward.
Wonderful, thank you. We've got a couple of questions. We're running short on time, so I'll just quickly run through these. Where social distancing cannot always be adhered to, is it possible or permissible, should we say, to make the wearing of face masks compulsory?
I think that could be Claire, you, is it, or Dave?
Shall I start?
Yeah.
I've been leading on the use of personal protective equipment in non-healthcare sectors. So the primary controls for controlling the risks from COVID in the workplace are social distancing, and we don't think that PPE is the answer. The answer is to go back to your risk assessment and look at what you've done in your workplace that you can affect to put in place other controls. Face coverings are being used in the general population to control situations where you aren't with people who you're normally with. So when you're going into shops, when you're going into crowded areas, and we would encourage you to continue to do that. But at work, you should look for alternative controls and not rely on personal protective equipment. Dave, I know you've been doing a lot of work on the social distancing. So do you want to pick up on some controls they could choose instead?
Yeah, I mean, I think also it's also sort of realigning your focus. Your businesses aren't generating the virus. So if you, where we would traditionally look at PPE as a control, it's where that is generated the process. So for example, in a bakery, it'd be flour dust, which is an asthmagen. And therefore you look at those sorts of controls once you've done everything else. So your business is generating, what you're looking to do is mitigate the effects of somebody bringing the virus to work and then that transmitting person to person. That's what it does. It goes from person to person. So what you need to do is to look at how you and what's in your control within the workplace can reduce that as low as reasonably practical. And the best way of doing that is keeping people at least 2 meters apart. And that has all sorts of benefits for you, for the business. It has all sorts of benefits for the wider population and preventing the widespread transmission of the virus. What it means that if you can maintain social distancing or the equivalent of that, and there are, you can have screens, barriers, all sorts of things that you can do to give you as good a standard as being 2 meters apart at all times, means that should somebody be tested and is positive, then when the test and trace and the questions are asked and somebody comes and looks at your business, because you've taken those controls, you have effectively kept your business running, because only that one person would have to stay away, and if they're tested positive for the 7 days before the symptoms go away, then they can come back to work. If you don't do any of these things, and essentially you treat your whole business as one cohort, if one person is becomes positive, then that means everybody's got to go home under those requirements. So it's got two functions really: your risk assessment and your controls. Is one, it's business continuity, it's protecting your business, and also it's for the greater good in that we're keeping the transmissions rate down, so that one person isn't transmitting the virus to lots and lots of people. So in your business, try and look at the high footfall areas are your greatest risks, and any areas where people are spending a lot of time together. You know, proximity and time are the key factors in all of this. And you know, social distancing, the 2 meters or the equivalent are your best way of organising your business, and they're the best way to protect your business going forwards as well.
Can I just pick up on a point, and that is, I noticed there's a bit of a chat going through the chat lines, and Claire, you might want to pick up on this. Quite correctly, people are being pointed out that face coverings are not PPE, they're face coverings. And where PPE is required for the task in hand, then they're usually marked with a mark that signifies thus, isn't it, Claire? Just to make clear, PPE is a proper defined requirement in certain areas and carries certain standards.
Yeah.
What a lot of people are wearing is just face coverings.
Yeah, so if you need to provide personal protective equipment in the workplace, you need to have a CE marked personal protective equipment, unless you work in healthcare. And there is a derogation in the healthcare industry at the moment because the demand has been so high. But for everybody else, for all of us working in factories or in manufacturing, there's no derogation. Your personal protective equipment must be CE marked. Your personal protective equipment protects you as the wearer. The face coverings that are being advocated by Public Health England and the Department of Health and Social Care are designed to protect everybody else should you be carrying or shedding virus. So the face covering protects everybody else from you, whereas personal protective equipment protects you from the environment you're in. And other than that, Martin, I won't take up any more time.
Wonderful, thank you. We've got a couple more questions coming from Alan. Thanks, Alan. A couple here, I'll answer the question both now. Is a summary of COVID-19 risk assessment results on the website sufficient rather than full assessments? And he goes on to say, is it reasonable for employers to require employees to sign a cessation document with ongoing obligation to declare they have no symptoms or living with anybody with symptoms? Who wants to pick up those? I
didn't fully catch that. I don't know whether you did. Is it something you can pick up on, David?
Yeah, I'll do the first bit. In particular on the risk assessments, it's entirely up to the business what they want to do. It was guidance that suggested that business may wish to do this. It's certainly something that the HSE in particular wouldn't be enforcing. Some businesses, such as some of the large global international companies, have produced very glossy brochures on what they're doing and how they're implementing controls within their workforces across the world. I mean, these are 60, 70-page documents, not suggesting that's right for everyone. Some people have done a simple thing, and you can print this a little like self-certifying certificate off the BAYS website, which basically says, we as a business, we've carried out an assessment, we've implemented our controls, and we believe we've done all that we can. And you can put that up at a public-facing point or in the employees' areas, wherever they are. Or if you wish to publish a summary, it's entirely up to you. I think there are some benefits, and certainly with customer and consumer confidence. And again, as Rob's been talking about, also about employee confidence. If you're reopening a business and bringing people in, the fact that you can say, look, we've done all these, and you share those. I mean, I think the important thing is you share the contents of your risk assessment, your controls with your employees, first and foremost. And then they say if they think there may be some benefits towards your customers, visitors, contractors, etc., then again looking at something that's fit for purpose for them. So that's what I would suggest on risk assessment.
around documentation, whether it's reasonable for employers to require employees to sign a document with ongoing obligation to declare they have had no symptoms or they're currently not living with anybody with symptoms.
That certainly isn't something that we are particularly looking at.
No,
in fact, it's the first I've heard that come up, and I just don't feel that is a particularly appropriate thing. What we do know is that, particularly in the healthcare sector, everybody is being encouraged to make sure that if they have symptoms, they don't come to work, they go and get tested. And if they prove positive, then they have to go through the normal isolation and that people have been asked to do. So there is, if you like, an absolute encouragement for people to put themselves in for testing when they've got symptoms. But beyond that, there certainly isn't something that we've been going around saying people must sign a document to say that they're all right. And that would not normally be our approach to health and safety either.
Wonderful, thank you. Going back on one of the questions or one of the sort of comments you made around, I guess, sort of risk assessments. What litigation might I face if I get the risk assessment or H&S aspect wrong? What are the benefits of a third-party certification?
It depends. The simple, quick answer is it depends, because obviously it depends on how wrong you got it. Obviously, if businesses have made a reasonable attempt and have done the best that they can, obviously that would be at the lower end and probably will be verbal advice from ourselves or potentially written advice. If people hadn't done anything or had completely misinterpreted or actually sort of used the process not to make any changes, not actually doing what we would suggest would be suitable and sufficient, properly addressing the risk, then obviously that would go up the enforcement scale. Saying that, the best people to do risk assessments are those people that are involved day to day with the processes in the business. If you're bringing in third parties or consultants to do these things, you can. It's entirely up to you. But also you have to bear in mind that they don't know your business like you do, and they don't know the staff like you do. And so you're going to have to ensure that you invest a bit of time in making sure they get up to speed with that. But what it can do, and any time where businesses find it beneficial, if they haven't necessarily got the skills or the time to do it themselves, then they'll invest that in somebody else. But it does come with some overhead, because what you don't want is for somebody just to print a generic document off and put your name at the top and say, there you go, that's yours, when actually what you need is something tailored to your business. So for me, the best people to do it are the people within the business, but we do appreciate there are circumstances where the business don't have time or maybe feel they don't have the skills, and therefore they can bring people in, but also be very careful of who you choose to do that. And the best thing is to ask other businesses around that have used them, but that also requires a little bit of overhead from yourselves, because they've got to understand your business to do a really good job for you.
There's probably two things just to bear in mind here. There is the health and safety at work requirements, and then there's the public health requirements under in the COVID environment. And basically, some of the key words in health and safety are about being proportionate and reasonably practicable. And the best people to decide whether it's a proportionate risk are the people, as David just said, who are involved in the processes, know what can typically go right and what's safe and what isn't safe. And reasonably practicable is that you've got to do everything that will make sure that you have managed that risk within reasonable practical controls. And again, there's an element of judgment here, but that is also where the Health and Safety at Work Act is actually at its strength rather than its weakness, and that is, it means that we aren't asking people to adhere to hundreds and hundreds of checklists of things. It means you can look at your circumstances and decide what's reasonable possible. what we've found in the public health context under the guidelines on COVID, it's been actually quite gratifying. And as I said in my comments, nearly all the companies that we talk to have really tried their best to do the right thing. Where people have probably raised a concern with us and we've gone to the company, we've found that actually they've looked at it and they've put it in place and changed it very quickly, and we've all been very pleased about that. We've gone back and checked with the person who complained or was concerned, and they're invariably saying that it's been fixed. So actually on the public health stuff, the response has by and large been positive, and I gave you some of the examples of where people let it just sort of slip a bit or not quite got it quite right, but that's how we try and help people to get it right rather than catch them out. But Health and Safety at Work Act things have not changed at all as a result of this, and that's why those words I gave you stand out as being the bywords, if you like, of a lot of the approach to health and safety.
Thank you. Final two questions. The next one seems to be on a similar theme around litigation. Will there be more HSE spot checks being carried out to make sure companies are complying, and therefore potential for more fines?
Yes, there will certainly be more spot checks. I'll hold back on whether there'll be more fines or not, but the government announced that there would be spot checks. They've told us and local authorities to do more spot checks. And in my comments, I did say that, as people are probably aware, our approach typically, from a health and safety executive standpoint, is to look at those areas of greatest risk. That's where we concentrate our efforts. It's where we try to make sure that we give as much protection of people at work as possible, and in the going, try not to disrupt business too much, because when an inspector turns up, clearly that can be disruptive on the day or whenever it is. So going to the places of maximum or potential risk as we see it are the ones where we concentrate on. Now, the government has said, no, this is slightly different. When you look at the COVID guidelines, we're asking people to spot check this and not necessarily use the normal, what you might call health and safety risk guidelines as to where you will go. And to some degree, one can see that, because actually where you are gathering several people together, that's where the public health risk may well arise, not necessarily from the traditional process or whatever, though clearly that has some implication the more complex you get. So that is really where we would look at it. I don't know whether any of the team want to add or comment further on that.
Just very quickly, I mean, what we are finding is that the vast majority of businesses are doing really well on this. They've actually taken it and ran with it and implemented it. And I think the last figures that I saw, those businesses where we had to either write to them or take anything that was between 10 and 12%. So an incredibly low percentage of if we look at on sort of traditional health and safety issues, it's probably 3 times lower and more than we would normally see if we went out just to, say, randomly sample, look at occupational lung disease or look at manual handling issues. We'd probably look at least 33 to 50% of cases where we'd have to give them some written advice or more. For the COVID issues, I said we're running around between the 10 to 12%. So overall, it's a good picture.
Right, thank you. Final question, unless anyone else has anything else. Again, on the topic of PPE and face coverings, does central air conditioning at the workplace contribute to spreading the virus?
Is that you, Claire?
I can start, and then I'd ask David to help out. We would ask that where you've got an air conditioning unit, you set it to pull fresh air in from outside rather than having it recirculating at the moment. There isn't any evidence to suggest that air conditioning makes transmission of the virus worse, but there is evidence to suggest that what you do need in your workplace is good ventilation. So open windows, make sure that there's a good flow of air. If you have got an air conditioning unit, then make sure it's pulling fresh air and that you don't have it on recirculating. Is that about the limit of it, David?
Yeah, the thing to remember is air changes. Changing your air is a really, really good thing. The problem can be with those little units that you find in very small meeting rooms with no windows and just one door. And the reason for having the air conditioning unit in there is to cool the air and nothing else. It's actually just recirculating the air in that room. And those are situations where actually there's probably a room, if you can take it out of use for the time being, don't use it for any prolonged period, or just use one person at a time, because that's a situation where you'll just get the same air recirculated round and round. On the freestanding units that sit in larger workspaces, not an issue. And again, the centralized systems, all of them will have some features, and it'll balance between drawing fresh air in and recirculating a certain amount. The more fresh air you bring in, the better it is. If you're unsure about how to do that, or how to change your settings, then talk to your heating and ventilation or air conditioning engineers, or the original installer, who may well help you. But as I say, the thing to keep in mind is get fresh air in and push the stale air out. However you do that with a fan, with a centralized air conditioner, that's a good thing to do.
And the last thing I'll say is that there's guidance in relation to the use of air conditioning on the website that Martin's already directed you to. Within the COVID pages, there's specific guidance there.
Right, wonderful practical advice. Thank you very much. We're coming to the end of the presentation. Can I just say thank you very much to each of our speakers, Martin, Matthew, David, Claire and Rob. Much appreciated. I'm guessing if anyone else has any further questions, they can contact you guys directly via the website if need be.
That's correct.
Great, thank you very much. Right, moving swiftly on. That concludes our webinar today. Again, thank you very much. Upcoming webinars and networking events. A whole list is there in front of you. I'm not going to read off all of them for you. Plenty of online networking events for you guys to get your teeth stuck into, as well as similar webinars. Just to name a couple here. 4th of August, we've got an all-member networking event in the morning at 10 a.m, followed by those who are responsible for any sort of international trade. We have an International Marketing Essentials webinar taking place on the 6th of August. And then if I can fast forward on to the 3rd of September, as we're moving swiftly on to the end of the transition period, a lot of businesses out there are going to need help, advice and support around custom procedures and controls. We are hosting a webinar on that very topic. I'd be very keen to get you all on board with that, so please register your places as soon as possible. Thames Valley Heroes. So we are looking for businesses who have gone above and beyond the duty during the COVID crisis. On the 17th of September, we are giving you the platform to showcase the outstanding work that is done by local businesses. Please feel free to submit your local entries. It's free to enter. It only takes a couple of minutes, and closing date for entries are on the Friday, the 28th of August. And as I mentioned a few moments ago, we are entering the end of the transition period. People and the Thames Valley Chamber of Commerce are helping businesses around the area plan for the future. If you need any help, support, guidance on any aspect of international trade, we have created a transition hub on our website to help guide you and provide you with the most up-to-date recent information. So please visit the website, get in touch, and if you have any questions, please email us directly. That ends the presentation for today. Again, thank you very much to our speakers, Martin, Matthew, David, Claire, and Rob. I look forward to hoping to see all of you again soon on an upcoming webinar. Thank you very much.
Thanks, Sonny.
Bye.
Thank you.
Bye.
Thank you. Take care.
Bye-bye.